Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Ever get that feeling like you know someone's watching you or listening in? Maybe it's just us, because today we're going deep on paranoia.
Yeah, going way beyond just like regular suspicion, right? Like what happens when it gets to be too much, doesn't make sense, and really messes with your life.
Totally. We're digging into this paper called Paranoia, what it is, and how it affects mental health. Even for me, and I thought I knew a bit about this stuff, there are some pretty surprising things in there.
For sure. And that's why we do this, right? Cut through all the noise and bring you the most interesting parts.
So first things first, let's define things a bit. What actually is paranoia, and how's it different from just being, a cautious person?
Oh, good question. We all have some level of suspicion, right? Helps keep us safe. But paranoia, that's like taking it way too far. It's this feeling of mistrust, like this irrational fear that people are out to get you, even when there's no reason to think that.
So like your brain's going, danger, danger, all the time, even if there's nothing actually wrong.
Exactly. It's like, imagine your brain's threat detector is stuck on high alert. Even totally normal, innocent stuff can seem threatening or mean.
Ooh, that's a good way to put it.
Yeah.
And the paper talks about how paranoia, it's not like one size fits all.
Right.
It's more like a spectrum.
Right. On one end, you've got deep distrust. That's this feeling that the world's a dangerous place and people can't be trusted.
So it's more than just like being a little skeptical.
Yeah.
It's this deep down belief that everyone's out to get you.
Yeah, exactly. And then as we move along that spectrum, it can get worse to what we call hypervigilance. Ever catch yourself always looking around, feeling like you're being watched, even when you're totally safe?
Oh, for sure. Especially after a good thriller movie.
Well, that's kind of what hypervigilance is like.
Yeah.
Always on alert, looking for danger, even if it's all in your head. And then on the far end, we've got the delusions of persecution.
Those are the ones you see in movies, right? Someone's convinced there's conspiracy against them, even if it makes no sense.
Exactly. And while those extreme cases might seem, a little out there, the thing is, paranoia shows up in so many ways, to different degrees.
It's not always big and dramatic.
Yeah.
It could be subtle, quietly affecting how you think, feel, and act.
Absolutely. For a real-world example, think of someone who won't go to the doctor even when they're really sick because they're convinced the medical system's out to harm them. That's deep distrust, and it can have some serious consequences.
Wow. Yeah, that really shows how paranoia isn't just in someone's head. It can have real-world effects.
Right. Or think about someone who avoids any kind of social situation because they're sure everyone's talking about them or judging them. That's hypervigilance leading to isolation. And then on that more extreme end, you might have someone checking their locks and windows for hours, convinced someone's breaking in, even though there's never been any sign of that. That's a delusion of persecution controlling their life.
These examples are great for seeing how paranoia can affect people differently. But what makes people think this way in the first place? The paper makes it sound like there's no easy answer.
Yeah, it's not a simple thing. The researchers point to a bunch of factors like mental health, past experiences, even brain chemistry.
Okay, so let's break that down. What's the first thing we should look at?
Well, one big factor is if there are any mental health disorders. Paranoia can be a big symptom of things like schizophrenia, delusional disorder, even bipolar disorder.
So in those cases, paranoia is part of a bigger problem, not just a thing on its own.
Right. For example, someone with schizophrenia might hear voices that make their paranoid thoughts worse. Or someone in a manic episode with bipolar might have racing thoughts and big ideas that turn into paranoid delusions.
So it's super important to realize that paranoia can be a sign that something more serious is happening and professional help is needed.
Couldn't agree more. Getting help early can make a huge difference.
But what about people who don't have a diagnosed mental illness? Can they still have paranoia?
Definitely. The paper also talks about how trauma and chronic stress can lead to paranoia.
That makes sense. If someone's been betrayed or hurt before, it's understandable they might be more guarded and suspicious later on.
Exactly. Especially if those experiences happen when they were kids, when they're learning about the world and how to be in it. Imagine growing up always feeling unsafe or like no one understands you.
Yeah, it makes sense that your brain would be on high alert, trying to protect you.
Right. It's like your brain's always looking for danger because it's learned that the world can be a scary place. And even if there wasn't a specific trauma, chronic stress can wear you down and make you more likely to have paranoid thoughts.
like always being on edge, waiting for something bad to happen. I can see how that would twist your thinking and make you misinterpret things.
You got it. Stress makes it hard to think clearly. When you're dealing with a lot of stress, it can be hard to tell what's really a threat, and that can lead to more paranoid thoughts.
This is all making a lot more sense now. But there's another thing the paper talks about that surprised me, substance use.
Oh yeah, the connection between substance use and paranoia, which a lot of people don't realize.
Honestly, I always thought paranoia was linked to like illegal drugs, cocaine or meth. But the paper says even alcohol withdrawal can trigger it.
It's true. Alcohol, at first, it's a depressant, but when you stop drinking, it can really mess with your brain chemistry, leading to more anxiety, agitation, and sometimes, yeah, full-blown paranoia.
That's a good reminder that any kind of substance use, even legal stuff, can have unexpected effects on mental health.
Absolutely. And then, of course, you've got drugs like stimulants, hallucinogens, even some synthetic cannabinoids that are known to directly cause paranoia. They mess with neurotransmitters, especially dopamine, which plays a big role in how our brains handle rewards, motivation, and, yeah, threat perception.
Okay, so dopamine's important here. I remember reading that imbalances in this neurotransmitter can make paranoid thinking worse.
You're right on the money. That brings us to the final piece, the brain and how it works, and how that can contribute to paranoia.
This is where it gets really interesting. Tell me more about this dopamine connection.
Well, one theory is that for people who tend toward paranoia, their brain's reward system, which is really driven by dopamine, might be extra sensitive. So they get a rush of dopamine, that feel-good chemical, even in situations that are totally neutral or ambiguous.
So their brain's basically misinterpreting normal stuff as rewarding, which then makes them even more suspicious.
That's the idea. Imagine you're walking down the street and someone glances at you. Most people wouldn't even notice. But for someone with that heightened dopamine sensitivity, their brain might see that as a sign they're being watched, followed, even targeted. And that rush of dopamine reinforces that belief, making it more likely they'll misinterpret similar things in the future.
Wow, that's fascinating. It really shows how our brain chemistry can shape how we see the world, even if those perceptions seem irrational to others.
You got it. And it's not just dopamine imbalances. The paper also mentions that if there are structural or functional problems in certain parts of the brain, like the amygdala, which handles fear, and the prefrontal cortex, which helps with decision-making and impulse control, those can contribute to paranoia too.
So it's this complex mix of brain chemicals, brain regions, and personal experiences that all come together to shape how we see the world around us.
Exactly. And getting this, understanding how all these pieces fit together, is super important for figuring out how to treat and support people who are dealing with paranoia.
This has been so insightful so far. I feel like we've really laid out the groundwork for understanding what paranoia is and where it comes from.
I agree. And now that we've got that foundation, we can dig into how paranoia really affects people's lives. It's easy to think of paranoia like it's just, thoughts, something happening inside your head. But what we don't always see is how much it affects, like, everything in a person's life.
Yeah, you're right. The paper really goes into how serious the consequences can be if paranoia isn't treated. It's not just about feeling suspicious. It's about how those feelings mess with your relationships, your work, your ability to just enjoy things.
Absolutely. And one of the saddest things is social isolation. Think about living in a world where you're always afraid people are out to get you, where you can't trust anyone. That's got to be so lonely.
The paper even talks about how that isolation ends up making the paranoia worse.
Yeah.
The more someone pulls away because of their paranoia, the more they believe people can't be trusted.
It's a tough cycle to break. And that isolation doesn't just affect their social life, it can spill over into everything. Imagine trying to keep a job when you're always suspicious of your coworkers, or you're sure your boss is trying to get you fired.
Or even just going to the store and feeling like everyone's looking at you, judging you.
Exactly.
Yeah.
Everyday things that most people don't think twice about can become super stressful and anxiety-inducing for someone struggling with paranoia. And being on guard all the time, it takes a toll on both your mind and body.
The paper specifically mentions the link between paranoia and chronic stress, which we all know is bad news for your health.
Right, think about it. When you're constantly on edge, your body's pumping out stress hormones like cortisol and adrenaline. Over time, that can weaken your immune system, mess up your sleep, cause digestive problems, even increase your risk of heart disease.
It's like your body's always in fight or flight mode, which you can't keep up forever. And besides the physical effects, there's the impact on how you make decisions.
Oh yeah, absolutely. Paranoia can really distort how you see things, making it tough to think straight and make rational choices. You're coming from a place of fear and distrust, which can lead to impulsive decisions that you might regret later.
Like that example we talked about earlier, the person who won't go to the doctor because they're convinced they'll be poisoned.
Yeah, that's a pretty extreme example of how paranoia can have really serious consequences, but it's not always that dramatic. It could be something like refusing to open a bank account because you're sure the bank will steal your money.
Or pushing away loved ones because you think they're talking behind your back.
Exactly. And all these seemingly small decisions, if they're driven by paranoia, they can add up and really affect your quality of life. They can hurt your relationships, your career, your overall well-being.
It's like paranoia builds this wall between you and the world, making it harder to connect, to trust, to just live without being afraid.
That's a great way to describe it. And what's especially concerning is that this wall can also keep people from getting the help they need.
Because if you think everyone's against you, it's hard to imagine reaching out for help, right? You might worry that therapists or doctors will try to take advantage of you or control you.
Exactly. And that's why it's so important for friends, family, anyone who cares about someone struggling with paranoia to understand the signs and offer support.
But that can't be easy. How do you even approach someone who's stuck in that cycle of distrust and suspicion?
You're right, it's a delicate situation. And while professional help is often necessary, there are things loved ones can do to help.
Well, that's a perfect transition to the next part of our deep dive. Let's talk about what the research says about supporting someone with paranoia and what kind of treatments are out there. Okay, so we've covered how much paranoia can affect people's lives and how hard it can be to watch someone you care about deal with it. But the good news is this paper also talks about some really promising ways to treat and support people with paranoia. It's not like a hopeless situation or anything.
Definitely not. And the first thing, and this is really important, is realizing that paranoia, it's usually a symptom of something else going on. Could be a mental health condition, past trauma, even substance use. So you got to address that root cause.
So it's not just about making the paranoid thoughts go away. It's about understanding why they're happening in the first place.
You got it. And that's where professional help is key. The paper really emphasizes therapy as a core part of treating paranoia.
Okay, let's talk therapy. What kind of approaches work best for paranoia?
Well, one that stands out is cognitive behavioral therapy, CBT. It's been shown to be really effective in dealing with the thoughts and behaviors that fuel paranoia.
I've heard of CBT, but I always thought it was for things like anxiety and depression. How does it help someone with paranoia?
So basically, CBT is all about recognizing and challenging thought patterns that aren't helpful or realistic. For someone with paranoia, this might mean looking at the evidence for their beliefs, thinking of other explanations for things, and learning to see things in a more balanced way.
So instead of automatically assuming someone's out to get them, they learn to stop, question their assumptions, and consider other possibilities.
Exactly. And CBT doesn't just focus on changing thoughts, it also works on changing behaviors that make the paranoia worse.
Like maybe gradually exposing themselves to situations that trigger their paranoia, but in a safe way, right?
That's the idea. Say someone avoids parties because they're afraid of being judged. A therapist might help them make a plan to go to a small gathering and practice using their new coping skills to deal with their anxiety.
It's like you're teaching your brain to react differently to those things that feel threatening.
Exactly. Now, CBT is often the first choice for paranoia, but the paper does mention some other therapies that can be helpful too, depending on the person.
Oh, what are some of those?
Well, if the paranoia is coming from past trauma, therapies like EMDR, that's eye movement desensitization and reprocessing, or TFCBT, trauma-focused cognitive behavioral therapy, can be really good for processing those memories and lessening their impact on how you think and act now.
So it's about dealing with those old wounds that might be feeding the paranoia.
Exactly. And sometimes just having a safe space to talk about what you've been through with a therapist can be so helpful in reducing shame and isolation.
Yeah, that makes sense. What about medication? Does the paper say anything about that for treating paranoia?
It does. Medication can definitely be helpful, especially when paranoia is severe or connected to a mental health condition like schizophrenia or bipolar disorder.
So in those cases, medication helps manage the underlying condition, which then can help reduce the paranoia.
Right. Antipsychotics, for example, can help with delusions and hallucinations, while mood stabilizers can help even out mood swings that might be contributing to paranoid thinking.
But it's important to remember that medication isn't a magic bullet. It usually works best alongside therapy for a more well-rounded approach.
Definitely. And working closely with a psychiatrist to find the right medication and dose is crucial because everyone reacts to them differently.
Besides therapy and medication, the paper also talks about lifestyle changes and self-help strategies for managing paranoia. That's something we can all be proactive about, even if we're not dealing with severe paranoia.
Totally. Things like mindfulness meditation, regular exercise, a healthy diet, all of these can really boost mental well-being and reduce stress, which, like we talked about, can be a big trigger for paranoia.
It's like building up your resilience and well-being so you can handle those paranoid thoughts better.
Exactly. And don't underestimate the power of just connecting with people. Being around supportive people, even if it's just a few close friends or family, can make a huge difference.
Yeah, feeling like you belong and knowing you're not alone, that can be so powerful in fighting the isolation that often comes with paranoia.
Absolutely. And for people looking for more support, there are also online communities and forums where they can share their experiences with paranoia and get encouragement and advice from others.
That kind of peer support can be so valuable, especially for those who might not be ready to seek professional help yet. It reminds you that you're not the only one going through this.
For sure. And that's a message I really want to get across. There is hope. With the right support, treatment, and self-care, people struggling with paranoia can learn to manage their symptoms and live fulfilling lives.
This has been such an eye-opening deep dive. We've gone way deeper than just the surface of paranoia and really explored how complex it is, how it affects people, and most importantly, the ways to heal and recover.
I totally agree. And I hope our listeners take away the fact that paranoia isn't something to be ashamed of or to suffer with alone. There's help out there, and reaching out for that help is a sign of strength, not weakness.
It's about taking back your life from that fear and mistrust.
Exactly. And remember, even small steps toward taking care of yourself and finding support can make a big difference.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.